Is there a simple way to compare visual acuity tests?
A little bit bigger.
Okay. A Sloan matching card was used to enhance eETDRS that was performed on the M&S clinical trial suite.
Next one, click Acuity next. And find one that looks different. One of them will look different than the others. Kind of at the top, it'll look different. Perfect. Now, see if one looks different. Perfect. Now click Color. Left eye. You did that. Nice.
To compare two different types of visual acuity testing, we employed the electronic eTDRS and compared it for distance with PDI Check dicoptic autostereoscopic rivalry visual acuity at near. The subjects were over 8 years of age, 28 had treated amblyopia, and 13 were normal with excellent vision. We wanted to compare the interclass correlation coefficient for correlation and Bland-Altman plots. For example, this is a test-retest of e-ETDRS using the supernormals and the treated amblyopic patients with a tight correlation. Compared to this was PDI Check near test-retest and PDI Check compared to eTDRS for correlation comparison. Then we want to look at the Bland-Altman plots. This takes the mean compared to the difference between two values using log-Mar equivalent visual acuity. We compared eTDRS with PDI Check and found a large limit of agreement for the difference between the two, or the offset, one showing precision, the other showing accuracy. This is PDI Check versus PDI Check test-retest, and a tight Bland-Altman with eTDRS compared to eTDRS. These are compared here. Let's check the supernormals and the treated amblyopes, showing their limits of agreement, and use this real data to develop an optimum, an excellent, a good, a fair, and a passing limit of agreement for Bland-Altman for visual acuity comparison. That might be like grades, with an A+ being optimum. This compares limit of agreement with interclass correlation coefficient, comparing different examples, including the 3 from our research with 2 test-retests and a comparison between the two that we would expect to be not very well compared due to suppression with treated amblyopes. This allows us to show interclass correlation coefficient and limit of agreement compared with optimal, excellent, good, fair, and passing levels of comparison for visual acuity testing. An expense of the excellent or optimum is time, and we see here that eTDRS on the x-axis compared to PDI Check on the y-axis. In general, a patient who is quicker on one is quicker on the other, but notice the scale is different. There is significantly less time required for PDI Check. The electronic eTDRS system probably is the most precise visual acuity testing, but it takes almost 6 minutes to do both eyes. With eTDRS, we used Sloan letters and used a matching card and patched the non-tested eye with best corrected visual acuity. We also used best acuity on PDI Check near testing. Since most of the amblyopic patients suppress their vision, PDI Check's rivalry did not match eTDRS.